President Yoweri Museveni on Tuesday met with Dr. Samuel Oledo, the president of the Uganda Medical Association at State House, Entebbe. The meeting came just a day after Dr. Oledo was removed from the leadership of the association and handed a 4-year membership ban. Dr. Oledo had been accused of breaking the association's code of conduct when he openly begged President Museveni to contest in 2026 elections at youth event at Kololo earlier this month. In yesterday's meeting at State House, Dr. Oledo clarified that it had been requested long before the Kololo saga within the association. He added that the meeting was meant to discuss with the president the issues of deployment of doctors, the recruitment of workers, and to improve the health sector as a whole, which is now ongoing in the country.
The purpose of the delegation that led the president, because as of yesterday, the court still said status quo is maintained, that I am still the president of Uganda Medical Association. So I had requested for an invite earlier to meet the Fountain of Honor on behalf of my people that I lead, okay, on behalf of all health workers, to look at those key issues of deployment of doctors, to discuss the issues of having them being involved into 1, deployment, 2, being recruited, 3, also improving the health sector. And those are key issues that we have to look at. And also the president had pledged other things like the circle, boosting the circle, the 4 billion shillings, which these are things that needed us to sit down with the Fountain of Honor, appreciate him, and inform him of the milestones we've reached and how far we are going. So today was a very successful meeting. We discussed with the Fountain of Honor, and he actually accepted a lot of things, and doctors should be happy that they will have great transformation in the health sector. They will be happy to see great things being done.
The president of UMA called upon medical fraternity to render selfless service to the citizens and desist the habit of extorting money from patients as well as harassing them instead of applying the physiosocial support needed by patients. He advised the health workers to surrender themselves to the profession they subscribe to.
My message to the medical fraternity is we subscribe to transformation of lives, changing lives, and giving Ugandans hope. We have a very big challenge among us, having people who still have a mindset of extorting money from patients, who still have a mindset of harassing patients in the way they talk. No one comes to hospital when he's well. People come to hospital when they're sick, when they're crippled, when they're doing bad. So the message you give to an individual who has come sick, the shouting, can lead them to their grave early. So how you talk to our people is the first level of healing, the psychosocial support you give. Even if I have a terminal illness, but how do you talk to me about it?
Dr. Oledo added that the meeting also reviewed some of the pledges made by President Museveni, citing the boosting of the health workers circle with 4 million shillings and to brief the president on the milestone the Medical Association has so far registered. Uganda Medical Association was established in 1964 as a non-governmental professional organization that brings together all qualified and deregistered medical doctors in Uganda. The association has a membership of 5,000 health workers in Uganda and 3,000 in the diaspora. Anselm Ojaro, live at 8.